Well, day 26. It's 10 after 2 and I've kind of given up on any hope of having a day staff person come and at least offer me a basin of water to wash with. I did grab a cleaning staff and had them pass me my toothbrush and stuff, so at least I was able to brush my teeth. But again, haven't seen anybody. You know, since coming back to it, and as you can see, I'm starting to bruise up pretty good, and that's an indication that I've overstayed my welcome here. But I just had an issue here that sort of is reflective of, on the reverse side of what I've been doing for the last 3 years. For the last 3 years, I've been representing a lot of ESL families with children with disabilities to help them receive treatment for their kids in a culturally appropriate way. There's been a few issues around it. We have a government in Alberta that's very adversarial to change, and their own corporate culture is one where they really don't want much to do with advocacy or advocates. Just ask Dr.RajSherman and some of his friends who have actually, doctors who have left the province because of the abuse they had to put up with in trying to advocate for their patients. But trying to do a cultural competence has been, hell, they don't even know what it means in this province, let alone how to practice it. But in here, I'm seeing the opposite side of it, and that there's a lot of ESL staff working here who really are bringing many of their cultural beliefs into dealing with patients here who can't fully speak for themselves. This is, as I said, it's a warehousing unit, so a lot of seniors here waiting to go to long-term placement. I've seen too many instances in this room where there's we have one very nice gentleman who isn't very expressive for himself, and the language ability of some of the you get that a lot. Some of the support staff is pretty low, so when they don't get an answer right away, they just turn around and walk away. I find it humiliating when they decide they should check out his diapers rather than ask him if he'd like to go to the bathroom, which he tries to do many times on his own and is quite capable of doing. But the staff find it easier to do that. Now, that's a cultural thing, so cultural competence has to go two ways. I think many of the people working here have to get to know some of our cultural issues as well and treat patients accordingly. And I think it becomes incumbent on healthcare in this province to be doing some cultural sensitivity training for not only Canadian thinkers, but for non-Canadian thinkers, so that we can meld these two cultures and make things work here. The demographics are dictating that in Alberta, but it's not being practiced. So I find myself now advocating for people in this room in a complete opposite way that I was doing for families, because now I'm looking at it from the perspective of Western culture and saying, hey, this is the way we do things in Canada. You know, you don't just ask somebody, don't wait for an answer and walk away. That's not good enough. You know, treat them with a little bit of dignity, treat them with some respect. They're not just, they're not product. You know, they're not here to be moved to the next shelf, and that's kind of what I'm seeing here, and I'm starting to get pretty fed up with it. 26 days of lying around watching this stuff and getting all bruised up because they've decided they'll make needles just a little bit more difficult. I mean, this one, the last one I got, they didn't even bother using an alcohol swab to clean the skin before they gave me the shot, and that's just ridiculous. So I asked for a couple of alcohol swabs of my own, and I brush down the site myself now. It's called self-care. Welcome to the new healthcare in Alberta. Premier Redford, get busy on this inquiry. Let's get our shit together here, and there's a whole lot of issues that have to be dealt with, and we can't afford to put it off anymore. Rather than wasting all that money on all these ridiculous policy makers in Alberta Health Services, let's put the money where it should be, and that's towards good, effective patient care. That's it for now. Who knows, I may be back. Hopefully I may even get a basin to wash with later on the next shift, but right now it's too close to shift change to hope that anybody's going to come in here. From 45 minutes before shift change to 45 minutes after shift change, there's an hour and a half, 3 times a day. You can kiss goodbye. So catch us later. Have a good day. Bye-bye for now.